Welcome back once again. Today is the 27th of February 2022. We are clearly out of the third wave. As a large geography of India is concerned, whether it is Mumbai, whether it is New Delhi, various urban areas of Mumbai, semi-urban areas of Mumbai like MMR or NCR, whether it is the rural hinterlands of India, clearly we saw a tsunami-like Omicron wave, which came very, very fast and has declined also very rapidly. Multiple impacts Omicron has left. The first impact is that it was a nose and throat COVID and no lung COVID. The second impact it left is that the vulnerable immunocompromised group was still hit very, very hard. And a small minuscule percentage had Delta and some lives were still lost. We still have active virus in circulation. So there is no room for complacency, as WHO has warned, and worldwide, though the COVID numbers look brighter, both in Europe and North America, the waves have started to recede as the winter has started to recede. It's a short month of February. On 1st of March will be Mahashivratri. I wish all our viewers a very happy Mahashivratri. And we clearly can see that the COVID protection or the COVID coverage around Indians is more robust. We have had a very large exposure of our population to the virus, either asymptomatically, pre-symptomatically or symptomatically, either those who tested positive or those whose antibodies will test positive. And we also have had one of the best and the largest vaccination programs on planet Earth. Though Omicron virus had immune escape and ducked the natural antibodies or vaccine-induced antibodies, the disease was predominantly mild, with symptoms being mild, and moderate disease, severe disease, critical disease, and deaths were rare and few. So our current goal on 27th February, as we talk today, 2022, is very simple. Zero COVID deaths, least number of cases in critical care units as well as severe disease, and ensure that we take care of our vulnerable group, comorbidity group, immunocompromised group in a competent way. Continue expanding our vaccination coverage with the precautionary dose to the people above 60, to the healthcare workers and frontline workers. Increase and improve the access to the adolescents and restart economic and educational activity. Very clearly there. But a lot of people who got Omicron have had a huge and palpable impact on long COVID. The commonest symptom I'm seeing in my clinic in people who have suffered from Omicron has been persistent fatigue. And they are tired, they are drained out, they don't feel fresh. In all these cases, under medical supervision, I recommend them to do a complete blood count examination, a CRP examination to know if there is any inflammatory state. Sometimes in high cardiometabolic cases, I ask them to do an ECG echo and a D-dimer test. I ensure that if they have a cardiometabolic underlying comorbidity, they have adequate antiplatelet, anticoagulant, and statins on board. Because you remember that the thrombocoagulable and inflammatory state was the one which caused sudden deaths, even up to 3 to 6 months after COVID had gone in the Delta wave and the Wuhan wave. So first thing is, if you are feeling persistently tired, persistently fatigued, get a CBC CRP done. Get your antibody level done under medical supervision. Get your cardiometabolic status reevaluated. Get your glucose tested. Get your thyroid function tested. Do your free T3, free T4, TSH. But all this has to be done under medical supervision. Get your B12, D3 checked up. Often we give them micronutrient supplementation where deficient. So if you are deficient in D, correct the D. Try to keep your D above 50. If your B12 is low, try to correct the B12. If you have any other micronutrient which is depleted, ensure that it is sufficient. Try to take a high protein diet. use protein supplements under medical supervision if needed. We also give a lot of immunity boosters, which are non-specific, including traditional remedies like ashwagandha, which have been used very efficiently. And beyond that, we have recommended that people should do yoga. In yoga, there are multiple components. First is the kriyas or the cleaning processes, like the neti, which is cleaning up of the nose, the dhavati, which is cleaning up of the abdomen, or the colonic enemas. Those are the kriyas. Then we recommend them to do asanas. Asanas include Surya Namaskar, which is the simplest asanas, Uthak Baitak, and various other postural exercises to improve the overall physical health and muscle strength, toning of the muscles and the posture of the muscles, including Kapalbhati for abdominal fat, particularly useful for cardiometabolic risk patients. We also tell people to do pranayama. Pranayama not only clears up the nose and throat and the lungs, but improves oxygenation in the alveoli. Even though Omicron COVID has been predominantly nose and throat COVID, it is very useful as an exercise, as a pulmonary rehabilitation exercise, particularly because of the winter season. A lot of people who have underlying lung diseases are tremendously benefited from pranayama. Beyond that, we ask them to do meditation. We ask them to chant the mantras like Gayatri Mantra. We have shown that Gayatri Mantra has an impact, or chanting of mantras, whichever religion they go, has a very positive impact because it engages the mind and the body. It reduces anxiety, negativity, and the fear of uncertainty. The other thing we have seen with people with Omicron is people thought that they have got COVID twice. They have taken 2 doses and now nothing can happen and they start unmasking. Please don't do that because Omicron has 2 variants, BA1 and BA2. If most people got the virus with the BA1, the BA2 can still occur. So Omicron can recur, but that is very rare. The Delta is still very much in the circulation, but very, 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 very small. 95% it is Omicron. And if we do not mask, do not focus on humidity between 40 and 60%, do not focus on air ventilation, open air spaces, and continue our vaccination, we could still have another wave of disruption. Currently, it is a very reassuring sign. As we talk on 27th of February today, right now, and at noon, clearly as Mahashivratri is coming up in 2 days from now, we are seeing the end of the third wave, clearly. Unless we behave irresponsibly and recklessly, we will see the end of the third wave. And it's very unlikely that a tail will come up. Most of the restrictions which are prevailing, the central and state administrations now are under a thick review to ensure that unlocking can happen as early as possible, as quickly as possible to a larger population at large. But vaccinations save lives. So please get vaccinated if eligible. Please get double vaccinated if eligible. Vaccinations not only save lives, but also save you from critical and severe disease and are immunity boosting agents. Focus on nutrition, focus on memory, focus on fatigue, focus on muscle strength, focus on mind-body rehabilitation after COVID. Focus on your health. A lot of people in the last 2 years have not looked after their other medical problems. Whether they have medical problems, psychological problems, health problems, they have just not gone back to their doctor. So get your health checkup done. Get your overall assessment done by a doctor. Because if you have a disease, please get it checked up. If you didn't have a disease and you are healthy, it is fine. But if you had a disease, please go back to your doctor for treating your blood pressure, treating your diabetes, treating your heart disease. If you had cancer or kidney problem, go back to them and get it sorted because the delay can cost you dearly. So ensure that refocus on health. As on 7th of April, we will have the World Health Day. We want a healthy Mumbai, healthy Maharashtra, healthy Delhi, healthy NCR, healthy India, healthy world. We are in Vasudevam Kutumbam and we are clearly looking at a very positive impact in which we want to have good health. We want to have positive health. The lifestyle tips are very simple. We need to eat slowly. We need to eat on time. We need to eat right. We need to focus on fruits and vegetables. We need to focus on the right nuts, the right micronutrients and the macronutrients. We need to focus on muscle strengthening proteins, which are biologically available through both vegetarian and non-vegetarian sources. We clearly need to focus on immunity modulating substances, including herbal extracts like ashwagandha, carnitine, and so on and so forth. And we need to then exercise. We need to do yoga. And we need to be cheerful, smile, and positive. We need to, if possible, avoid crowds, avoid closed, poorly ventilated spaces, ensure our humidity is 40 to 60, and ensure that we are masked when we are in a crowded environment or when we are in a closed, claustrophobic space. So be responsible, be safe, be cheerful and positive, get back to a post-COVID world with COVID around us. If you have symptoms, do self-test, self-isolate, report to your doctor, treat it without panic and without any hesitation. But I think the worst is over. The best days and the better days without COVID are around us. If we behave responsibly, we will see the end of COVID. We will see in the next couple of months WHO declaring the end of the pandemic, and we will see a new world order after COVID. We clearly have indications on that direction. However, the global experts, including myself, are clearly warning that if we behave irresponsibly or recklessly, we can still generate a new variant of concern, which can consume us after a few months. So with that fear in mind, we need to still behave responsibly. We still need to mask for a little longer time over the next couple of months. The advisories will keep changing, but I think better days are here. From Mahashivratri onwards, there will be months of fasting. Whether there will be months of fasting in the Hindu calendar, Lent will start in the Catholic calendar, the Ramadan will come up soon in the Islamic calendar. We will see fasting, we will see festivities, we will see normalcy, we will see schools reopen now, we will see vacations and travel starting, we will see resumption of normalcy. And as we see resumption of normalcy, responsible behavior with happiness and health will be the key. And therefore, we would really like to thank, we would like and love your suggestions, because now we are not going to discuss COVID every time. We are going to change gears. And when I meet you next week in the month of March, we are going to start discussing newer topics of health in the non-COVID space now. And we would love your suggestions, what you would like to hear from us. Your feedback is very valuable. Once again, I thank Anirudh Sapatnekar from 1MD for continuing this show to ensure that we can be healthy and we can be healthy. So be healthy, be happy, and thank you.